Question 1. From the perspective of optimizing image acquisition during a renal artery duplex ultrasound, which technique should be prioritized when evaluating for suspected renal artery stenosis in a patient with chronic hypertension and renal dysfunction? A. Using a low-frequency transducer to increase penetration in obese patients. B. Applying high-wall filter settings to reduce venous noise. C. Initiating spectral Doppler sampling exclusively at the midpole of the kidney. D. Maintaining a Doppler angle of 90 degrees to reduce aliasing. Answer. Correct answer. A. Explanation. Using a low-frequency transducer, typically to 5 MHz, is optimal for penetrating deep structures such as the renal arteries in patients with high BMI. Proper insufflation allows accurate velocity measurements, critical for detecting renal artery stenosis. RVS high-wall filters, option B, may eliminate important low-frequency signals. Doppler sampling at only the midpole, option C, misses data. RVS is often at the ostium or proximal segment. Doppler angle of 9-tidig, option D, produces no measurable velocity. Cosine 9-tidy will 0, making it diagnostically invalid. Maintaining an angle between 4.5, 6.0 is recommended. Reference: SVU Clinical Practice Guidelines, AM Guidelines for Renal Artery Duplex Ultrasound. Question 2. As demonstrated by the case of MS Evelyn, a 63-year-old woman undergoing a carotid duplex scan, the sonographer notices spectral broadening and peak systolic velocity, PSV, exceeding 230 centimeters in the right internal carotid artery. Which interpretation best aligns with this finding? A. This is consistent with a 70% stenosis. Answer. Correct answer. D. Explanation. According to Society for Vascular Ultrasound SVU guidelines, a 130 centimeters in the ICA along with post-stenotic spectral broadening suggests 70% stenosis. Option A is incorrect, as 50% stenosis has much lower velocities. Near occlusion, option B, typically shows extremely high PSV followed by low diastolic flow or aliasing. Option C applies to velocities between 125–230 centimeters. Accurate angle correction and image quality are critical in interpreting such findings. Reference: SVU Consensus Criteria for ICA Stenosis Classification. Question 3. Taking into account hemodynamic principles, how does an increase in vessel radius most directly affect blood flow, assuming constant pressure and viscosity? A. It decreases blood flow due to increased turbulence. B. It increases resistance and reduces flow rate. C. It causes a linear increase in flow rate. D. It causes an exponential increase in flow rate. Answer. Correct answer. D. Explanation. According to Poiseuille's law, blood flow is proportional to the fourth power of the vessel radius. Thus, small changes in radius result in exponential, not linear, changes in flow. Doubled radius increases flow by 16 times 24. Options A and B misunderstand the principle. Although turbulence may increase with larger diameters, the net flow rises significantly. Reference: hemodynamics and blood flow principles, Poiseuille's law. Question 4. When considering transcranial Doppler TCD ultrasound, which of the following findings most strongly suggests a vasospasm following subarachnoid hemorrhage? A. Decreased mean flow velocity in the middle cerebral artery MCI. B. Increased pulsatility index pi in the vertebral artery. C. Mean Mercalli velocity 200 centimeters with Lindegaard ratio 6. D. Presence of low resistance flow in the posterior communicating artery. Answer. Correct answer. C. Explanation. Mean Mercalli velocity 200 centimeters and a Lindegaard ratio Mercalli velocity 6 strongly suggests severe vasospasm, particularly after SA. A decreased velocity, option A, indicates hypoperfusion or occlusion, not vasospasm. Increased pi in the vertebral artery, option B, may indicate downstream resistance but not vasospasm. Option D reflects collateral flow, not necessarily spasm. Reference: On and this SVU guidelines are for TCD vasospasm monitoring. Question 5. Mr. Donnell, a 58-year-old patient undergoing a duplexed scan for lower extremity arterial disease, exhibits monophasic flow in the superficial femoral artery with delayed upstroke and decreased systolic peak. What is the most likely interpretation? A. Normal finding due to collateral development. B. Evidence of proximal significant arterial obstruction. C. Sign of distal embolic event. D. Indication of vasospastic response in calf vessels. Answer. Correct answer. B. Explanation. A monophasic waveform with delayed systolic upstroke typically indicates proximal arterial obstruction. E.g., iliac disease. Reducing perfusion pressure, it is not normal. A. Embolic events. C. Present with abrupt occlusion and absent flow, not waveform alteration. Vasospasm. D. Would affect smaller, more distal vessels. Reference SVU guidelines on peripheral arterial duplex interpretation. Question 6. Contrary to popular belief, what is the most likely consequence of applying excessive transducer pressure during venous duplex evaluation of the lower limb? A. Enhanced detection of reflux in superficial veins. B. Artificial augmentation of venous flow signal. C. Compression of deep veins simulating thrombosis. D. Elimination of color aliasing artifacts. Answer. Correct answer. C. Explanation. Excessive transducer pressure can compress deep veins, reducing or eliminating visible flow and mimicking thrombosis, a diagnostic pitfall. Option A is incorrect, as overpressure may suppress reflux visualization. Augmentation of flow. B is typically manual via distal compression. Color aliasing. D is managed to PRF adjustment, not pressure. Reference IAC standards and SVU guidelines for venous duplex imaging. Question 7. As illustrated by Esther Chen's case, a 70-year-old with a history of portal hypertension is evaluated using Doppler ultrasound. Which Doppler finding would most strongly suggest reversal of portal venous flow? A. Increased hepatoductal flow with continuous waveform. B. Epitofugal flow direction on spectral Doppler. C. Monophasic waveform with respiratory variation. D. Elevated resistive index 0.80 in hepatic artery. Answer. Correct answer. B. Explanation. Hepatofugal flow away from the liver in the portal vein, is a hallmark of portal hypertension decompensation, often seen in cirrhosis or portosystemic shunting. Hepatoductal flow A is normal. Option C is non-specific. A high D in hepatic artery suggests hepatic arterial resistance but not portal reversal. Reference AM guidelines for abdominal vascular ultrasound, Doppler in portal hypertension. Question 8. Through careful analysis of waveform patterns in photoplethysmography PPG, which characteristic most strongly supports the diagnosis of venous insufficiency? A. Venous refill time 20 seconds without tourniquet. B. Increased amplitude of pulse volume recordings. C. Rapid arterial upstroke with delayed diastolic runoff. D. Loss of respiratory variation in the venous waveform. Answer. Correct answer. A. Explanation. Venous refill time 20 seconds or 10 seconds depending on protocols indicates valvular incompetence and venous reflux. Tourniquet testing differentiates superficial versus deep reflux. Increased PVR amplitude. B. Relates to arterial status, delayed runoff. C. Is arterial respiratory variation loss. D. May reflect proximal obstruction, not insufficiency. Reference SVU guidelines, venous reflux testing, AEP. Question 9. In the modern context of transducer technology, what is the primary advantage of using a phased array transducer in transcranial Doppler imaging? A. Superior penetration through soft tissue. B. Large footprint ideal for wide vascular imaging. C. Beam steering capabilities through narrow acoustic windows. D. Optimized surface imaging with high resolution capability. Answer. Correct answer. C. Explanation. Phased array transducers are preferred in TCD due to their beam steering through narrow cranial windows, such as the temporal bone. They use a small footprint and can electronically adjust beam direction. Options A, B, and D refer to other transducer types, curved or linear array. Reference Instrumentation in Vascular Ultrasound Transducer Selection Guidelines. Question 10. MS. Ortega, a patient with suspected Raynaud's phenomenon, is undergoing cold stress PPG testing. After immersion in ice water, her digital waveform amplitude significantly diminishes for over 20 minutes. What is the most appropriate conclusion? A. This is normal vasoconstrictive response. B. Indicative of fixed arterial occlusion. C. Diagnostic for Raynaud's phenomenon. D. Suggestive of neurogenic thoracic outlet syndrome. Answer. Correct answer. C. Explanation. Sustained waveform reduction post-cold exposure is the diagnostic criterion for Raynaud's phenomenon, reflecting vasospasm of digital arteries. Normal response A would normalize in 10 minutes. Fixed occlusion B wouldn't show reversibility. TOS D may involve compression during arm movement, not cold-induced changes. Reference SVU cold stress EPG protocols and diagnostic criteria for Raynaud's phenomenon. Question 11. Given the circumstances that a 52-year-old male patient presents with intermittent claudication and a history of smoking and hypertension, which of the following findings would most likely suggest peripheral arterial disease? PAD A. High ankle brachial index AB of 1.3 B. Non-palpable pulses in the lower extremities. C. Normal segmental pressures at the ankles. D. A large number of collateral vessels on ultrasound. Answer. Correct answer. B. Non-palpable pulses in the lower extremities. Explanation. The absence of palpable pulses in the lower extremities is a strong indicator of PAD, which results from atherosclerosis and impaired blood flow to the extremities. A normal AB should be around 1.0, 1.2, and value greater than 1.3 often indicates non-compressible arteries due to calcification. Collateral vessels may be present in PAD cases but do not confirm the diagnosis. Segmental pressures should be reduced in PAD, not normal. Question 12. In the context of carotid duplex ultrasound, a stenosis greater than 70% typically exhibits which of the following velocity characteristics? A peak systolic velocity, PSV of 150 cm. B, a AE of 150 230 cm with a high-end diastolic flow. C, a AE exceeding 230 cm with a very low-end diastolic velocity. D, a AE of 50 cm with absent diastolic flow. Answer. Correct answer. C. A AE exceeding 230 cm with a very low end diastolic velocity. Explanation. For carotid stenosis greater than 70%, the PSV usually exceeds 230 cm, indicating severe narrowing of the vessel. The end diastolic velocity will typically be low due to the restricted blood flow through the stenosed segment. In contrast, low velocities suggest less severe stenosis. Velocities with absent diastolic flow are indicative of occlusion. Question 13. A 45-year-old female presents with deep vein thrombus DVT in her left leg. Upon duplex ultrasound examination, a non-compressible hypoechoic thrombus is observed in the left femoral vein. What is the primary diagnostic concern for this finding? A. The thrombus is most likely an incidental finding with no clinical significance. B. The thrombus indicates a high likelihood of pulmonary embolism. C. The thrombus is unlikely to cause significant symptoms or complications. D. The thrombus should be evaluated for signs of arterial occlusion. Answer. Correct answer. B. The thrombus indicates a high likelihood of pulmonary embolism. P. Explanation. A thrombus in the femoral vein that is non-compressible and hypoechoic indicates the presence of which is a major risk factor for pulmonary embolism. P. It detaches from the vein and travels to the lungs, can block pulmonary arteries, leading to P. Early recognition and treatment of DVT are critical to prevent complications like P. Question 14. From the perspective of hemodynamics, which of the following factors would lead to a reduction in blood flow through a vessel? A. An increase in vessel diameter. B. A decrease in blood viscosity. C. A decrease in vessel length. D. An increase in vascular resistance. Answer. Correct answer. D. An increase in vascular resistance. Explanation. According to Poiseuille's law, blood flow is inversely proportional to vascular resistance. A higher resistance reduces blood flow. Resistance increases with a decrease in vessel diameter or an increase in vessel length and blood viscosity. Decreasing viscosity or vessel length, on the other hand, would typically increase blood flow. Question 15. The growing trend in vascular ultrasound is to use Doppler principles to assess blood flow in patients with suspected arterial occlusion. When assessing an occlusion with Doppler ultrasound, which characteristic waveform would be expected in A completely occluded artery. A. Triphasic waveform. B. High velocity and turbulence with no forward flow. C. Biphasic waveform with reduced diastolic flow. D. Absence of any Doppler signal. Answer. Correct answer. D. Absence of any Doppler signal. Explanation. In a completely occluded artery, no Doppler signal would be detected due to the lack of forward flow. A triphasic waveform typically indicates healthy arteries with normal blood flow, while a biphasic or high-velocity waveform with turbulence suggests stenosis rather than total occlusion. Question 16. Considering the evidence surrounding venous insufficiency, which of the following is the most likely contributing factor to the development of varicose veins in a 60-year-old patient with a family history of the condition? A. Increased arterial pressure in the veins. B. Chronic deep vein thrombus (DVT) leading to venous stasis. C. A defect in the venous valve function causing retrograde flow. D. Increased lymphatic pressure. Answer. Correct answer. C. A defect in the venous valve function causing retrograde flow. Explanation. Varicose veins are commonly caused by defective venous valves that allow blood flow backward, retrograde, leading to venous distension and visible veins. This is particularly relevant in older patients, and genetic factors may predispose individuals to this condition. Increased arterial pressure and DVT may contribute to other types of venous problems. Venous valve dysfunction is the primary cause of varicosities. Question 17. To better understand the physiology of microcirculation, which of the following factors would directly impact capillary filtration in a tissue with high metabolic activity? A. Increased tissue oxygen levels. B. A decrease in interstitial hydrostatic pressure. C. Increased capillary hydrostatic pressure. D. Reduced local lymphatic drainage. Answer. Correct answer. C. Increased capillary hydrostatic pressure. Explanation. Capillary filtration is primarily governed by the balance between hydrostatic and oncotic pressures. Increased capillary hydrostatic pressure forces fluid out of the capillaries and into the interstitial space, enhancing filtration. Metabolically active tissues often have increased capillary hydrostatic pressure due to higher blood flow. Decreased interstitial pressure or impaired lymphatic drainage contribute to edema, but they do not directly promote filtration. Question 18. A 35-year-old male presents with a suspected arterial occlusion in the lower limb. He undergoes an ankle brachial index (ABE) test and the result is 0.45. What does this value most likely indicate? A. The patient has normal arterial function. B. The patient has mild peripheral arterial disease pad. C. The patient has severe pad with high risk of limb loss. D. The ABE test result is inconclusive and requires further testing. Answer. Correct answer. C. The patient has severe pad with high risk of limb loss. Explanation. An ABI of 0.45 is indicative of severe peripheral arterial disease pad, which suggests a significant reduction in blood flow to the lower limbs. ABI values below 0.5 are associated with a high risk of limb ischemia and the potential for limb loss if left untreated. Mild pad would typically have ABI values between 0.6 and 0.9. Question 19. Research indicates that vasculitis can lead to significant damage to the vascular walls. Which of the following clinical signs would most likely be observed in a patient with large vessel vasculitis? A. Rapid onset pain and swelling in the extremities. B. Severe pain with pulsatile masses in the abdomen. C. Cold and numb extremities with reduced pulses. D. Elevated blood pressure and headache due to arterial inflammation. Answer. Correct answer. D. Elevated blood pressure and headache due to arterial inflammation. Explanation. Large vessel vasculitis primarily affects the aorta and its major branches, which can lead to elevated blood pressure and headaches due to inflammation of the arterial walls. This condition can also cause systemic symptoms, including fever and weight loss, and may lead to aneurysm formation or arterial rupture. Cold, numb extremities and reduced are more indicative of peripheral artery disease or small vessel vasculitis. Question 20. In terms of ultrasound instrumentation when conducting a carotid ultrasound, the use of a higher frequency transducer 1015 MHz is most beneficial for A. Achieving better penetration for deep vascular structures. B. Improving the resolution of superficial structures, such as the carotid artery intima. C. Increasing the Doppler shift to detect low-velocity blood flow. D. Reducing artifacts in the presence of calcium plaques. Answer. Correct answer. B. Improving the resolution of superficial structures, such as the carotid artery intima. Explanation. Higher frequency transducers 1015 MHz provide better resolution for imaging superficial structures, such as the carotid artery intima. However, they have limited penetration for deeper vessels, which is why low-frequency transducers 5-7 MHz are often used for deeper structures. Doppler shifts. Artifacts related to calcified plaques are also influenced by the transducer's frequency, but higher frequencies are primarily useful for resolution in superficial imaging. Question 21. A 62-year-old man undergoes an arterial duplex scan and a monophasic waveform is detected in the popliteal artery. Which of the following best explains this finding? A. A distal obstruction with postsynaptic turbulence. B. A normal finding in elderly individuals. C. A significant proximal arterial stenosis or occlusion. D. Presence of collateral flow compensating for occlusion. Answer. Correct answer. C. A significant proximal arterial stenosis or occlusion. Explanation. A monophasic waveform in the popliteal artery typically indicates proximal obstruction, such as significant stenosis or occlusion in the superficial femoral artery. Normal arteries display triphasic waveforms. Collateral flow may be present but does not explain the monophasic waveform directly. Question 22. During a venous ultrasound of the lower extremity, spontaneous and phasic flow is observed in the femoral vein, but no augmentation is noted with distal compression. What is the most likely cause? A. Chronic venous insufficiency. B. Deep vein thrombus DVT in the femoral vein. C. Technical error in Doppler angle. D. Obstruction in the iliac vein or above. Answer. Correct answer. D. Obstruction in the iliac vein or above. Explanation. Lack of augmentation with distal compression suggests a proximal obstruction, such as in the iliac vein or inferior vena cava, which impairs the transmission of venous pressure changes. If there were DVT in the femoral vein, compressibility and intraluminal thrombus would be visible. Question 23. A 48-year-old woman presents with dizziness and syncope. A carotid duplex ultrasound reveals a to and fro pattern at the origin of the subclavian artery. What is the most likely diagnosis? A. Vertebral artery dissection. B. Subclavian steal syndrome. C. Carotid body tumor. D. Aneurysm of the vertebral artery. Answer. Correct answer. B. Subclavian steal syndrome. Explanation. A to and fro or reversed vertebral flow pattern on duplex ultrasound, especially in the presence of symptoms like dizziness or syncope, is classic for subclavian steal syndrome, which occurs due to proximal subclavian artery stenosis or occlusion, causing retrograde vertebral flow. Question 24. Which of the following changes in Doppler signal characteristics would suggest a 50% stenosis in a lower limb artery? A. Biphasic waveform with slightly increased velocity. B. Monophasic waveform with peak systolic velocity 200 cm. C. Triphasic waveform with end diastolic reversal. D. Spectral broadening with A. 80 cm. Answer. Correct answer. B. Monophasic waveform with peak systolic velocity 200 cm. Explanation. At 100 cm, especially with monophasic waveform and spectral broadening, typically indicates 50% stenosis in peripheral artery. Triphasic waveforms are considered normal. The biphasic waveforms may indicate mild disease. Question 25. A patient undergoing renal artery duplex ultrasound shows a tardive parvus waveform distally. What does this pattern most likely indicate? A. Intrarenal arteriovenous malformation. B. Distal embolization. C. Proximal renal artery stenosis. D. Renal vein thrombosis. Answer. Correct answer. C. Proximal renal artery stenosis. Explanation. A tardive parvus waveform, delayed systolic upstroke and decreased amplitude, is highly suggestive of proximal stenosis in the renal artery, often due to atherosclerosis or fibromuscular dysplasia. Question 26. In the context of venous reflux testing, which of the following is the most appropriate patient positioning to evaluate lower extremity veins? A. Supine with legs elevated. B. Trendelenburg position. C. Standing or reverse Trendelenburg. D. Sitting with legs crossed. Answer. Correct answer. C. Standing or reverse Trendelenburg. Explanation. Standing or reverse Trendelenburg enhances venous filling and increases hydrostatic pressure, making it easier to detect venous reflux. Supine or elevated positions reduce venous pressure and may underestimate reflux. Question 27. In evaluating a dialysis access graft using duplex ultrasound, which of the following findings is most concerning for impending graft failure? A. Peak systolic velocity of 150 centimeters in the arterial inflow. B. PSV ratio of 2.0 in the venous outflow. C. Absence of thrill on palpation and low flow volume. D. Mild turbulence at the arterial anastomosis. Answer. Correct answer. C. Absence of thrill on palpation and low flow volume. Explanation. A missing thrill and low flow volume 3.0. Question 20. A 33-year-old woman presents with symptoms of pelvic congestion syndrome. Which of the following sonographic findings would best support this diagnosis? A. High resistance flow in the gonadal vein. B. Gonadal vein diameter 5 mm with reflux during Valsalva. C. Retroaortic left renal vein. D. Monophasic flow in the external iliac vein. Answer. Correct answer. B. Gonadal vein diameter 5 mm with reflux during Valsalva. Explanation. A dilated gonadal vein 5 mm with reflux during Valsalva is a key sonographic indicator of pelvic congestion syndrome, typically due to incompetent valves or venous obstruction. Question 29. In assessing an abdominal aortic aneurysm, EA, which of the following measurements would most strongly indicate the need for surgical intervention? A. Aneurysm diameter of 3.8 cm. B. Fusiform shape with minimal mural thrombus. C. Aneurysm diameter 5.8 cm with rapid growth. D. Asymptomatic patient with diameter of 4 cm. Answer. Correct answer. C. Aneurysm diameter of 5.8 cm with rapid growth. Explanation. Surgical repair is generally indicated for ear 5.5 cm, especially if there's rapid expansion 0.5 cm in 6 months, even in asymptomatic patients. Smaller ears are typically monitored. Question 30. During a duplexed scan of the lower extremity arteries, a sudden aliasing artifact appears in the midfemoral artery. Which setting should be adjusted first to clarify the image? A. Increase gain. B. Decrease wall filter. C. Increase pulse repetition frequency PRF. D. Lower transducer frequency. Answer. Correct answer. C. Increase pulse repetition frequency PRF. Explanation. Aliasing occurs when Doppler frequency shifts exceed the PRF. Increasing PRF allows for accurate representation of high velocity flow, reducing aliasing artifacts.